It didn't go the way you wanted to in court, but tell me what the case was really about.
Well, the case was really about literally, and this sounds extreme, but it was literally about giving citizens in this province the same rights that Quebecers have under the Charter of Rights, and the same rights that citizens in every other country on earth have. So I think, perhaps the most significant point is that there is no jurisdiction on this earth outside of Canada in which private health care and private health insurance are unlawful. That is a bit strange, and it's a very disappointing decision, but it's essentially an attack on the health of British Columbians. We have, according to the government's own documented statistics, which they fought to hide from us in the courtroom, but we got into evidence. At any one time, 40,000 British Columbians, and that, so you can extrapolate that to Canada. It's probably similar across the country. 40,000 British Columbians are waiting longer than the medically maximum acceptable time, beyond which serious problems arise with their health, and that those are BC government definitions. So this is at 40,000. If you add to that the other statistic from our trial, judges ignored both of these, that in Fraser Health alone, which is a health region in British Columbia, serves over 1 million people, 308 people died in 1 year on a wait list. To extrapolate that to Canada, it's about 6,500 a year, and that comes to 18 a day. Since we launched our lawsuit in January of 2009, 75,000 Canadians have died on a wait list. They've been sentenced by the system to serve out their remaining lives on a government enforced wait list. I mean, that's, to me, this is more than not unlawful. This is just illogical and ethically and morally wrong.
Was there a bit of a journey for you to come to realize as a doctor how bad the current system was? Could you take me into that a bit?
Yes. Well, when I started out here in the 70s, literally, I came in the 70s, it was a great system. Like, patients didn't wait. There were no wait lists. Surgeons could operate as much as they liked. When the patients needed it, you operated on them within a week or two. If they were urgent or cases, they were done the same day or over the weekend or in the evenings. That's all changed, and that all changed from the mid-'80s on, and then rationing. So what we have here is a government monopoly on the healthcare system as it relates to medically necessary services and hospital services. And, it's just empirically a fact that no monopoly serves the consumer well. But there are many startling statements in the judgment that came down. One of the things that's concerning to me is how the plight of patients has been ignored. It's all about some of the things that were said by the government lawyers in the courtroom were incredible and have not been cited in the judgment. The government lawyers said that the BC's Supreme Court, the Supreme Court of Canada, had been discredited in their Chowley decision, because in Quebec, of course, it was ruled a violation of the Charter rights if a patient was suffering on a wait list and you stopped them getting out off the wait list.
Yes.
So what we have here is in British Columbia, foreigners and non-residents from other provinces and visitors have rights of freedom that are denied to British Columbians. So yesterday, for instance, I operated on a patient, a young man from Alberta with a wrecked knee ligament, who he can come here and still can, completely within the laws of British Columbia and so on, and have treatment. But a BC resident with the same identical injury, it's unlawful. So there's no country on earth that has such laws. And that is crazy. Like, for Canada to be unique in the world in not allowing citizens to look after their own health, where the government takes a position. You know, we are all aware of authoritarian governments throughout the world, but none is authoritarian to the point that it controls the bodily health of its citizens and exerts power over them and essentially sentences them to a life imprisonment on a wait list. That's what it is. The government lawyers in our lawsuit called patients seeking private care parasites. They referred to them as parasitic. This is the kind of stuff that was ignored by the court decision. Also ignored, of course, was the fact that the judge had received surgery at a private clinic that would not exist if his ruling had applied then. Because even though the government was paying for his procedure, it was done in a private clinic where all of the equipment was purchased privately. That could not happen if this law existed back then. And there's a patient who was written up in the Vancouver newspapers of a 75-year-old with the same diagnosis and sinus infections that the judge had, who said, "I'm on a 2-year wait list. Why does the judge get to be funded privately to go to publicly by the government to go and get his sinus fixed, but I cannot?" But what this judge has done even more than that, it says you just have to wait till the government decides. It's not your choice, and even if you want to forego your vacation holiday and spend the money getting your health fixed, you cannot. This does not apply. The other interesting groups, which kind of puts things in perspective, is prisoners and federal employees are exempt from these laws. We are in court. We were in court arguing for the right of Canadians who aren't in jail to have the same freedoms under the law that it gives to prisoners. It's actually a very harmful ruling to the health of British Columbians.
Well, that is all very remarkable. Now,
yes.
Is this...
And it will come out in the appeal. It will come out in the appeal.
Oh, okay. How soon will the appeal be?
Well, we have to do it urgently, of course, because that's the way we cannot afford to have the government start to enforce this ruling. So we have to do it quite urgently.
With this ruling, then, it's going to even restrict things that are happening already. Like you were challenging it. You were challenging it to make it even better, but you're saying this ruling is going to make it even worse than it already is. So tell me how that works.
So right now there are 65,000 patients a year being treated in private clinics. They will all be added to the existing public queue. The other thing, of course, we can't, everything now has to relate to COVID-19 and the pandemic. As a result of the pandemic, waitlists in Canada are going to rise, according to a McMaster study, 4 to 7 times. This is a crisis, and the judge and the judgment have not addressed those problems. I mean, to be fair, this trial went on before the COVID crisis hit, but it did not go on before patients were suffering and dying on waitlists, and that's what the other outstanding thing, and this also is something that eats my heart, if you like, is the fact that groups in court opposing us have all used private clinics themselves, and that's a real problem for me with hypocrisy. Even the defendant in the trial, the British Columbia Attorney General's office, sends patients to our clinic. That's how remarkable and that's how bizarre and actually corrupt this process has been.
Can you explain?
And that was in evidence at trial. That statement I just made was in evidence at trial. The court decision does not address it at all, doesn't mention it.
Now, is the problem the Canada Health Act that has restricted private and public, or is it the way that it works only in British Columbia? Where is the actual problem?
Well, we've operated operated for 25 years with the support of government. I mean, we opened right in the middle of a 10-year ruling of the NDP in British Columbia in the mid-90s. So we've operated for 25 years. It's, as you know, it's legal to treat injured workers, and that's how we mostly started off. Then we decided, well, how can you possibly turn down patients who are desperate? And of course, because there's no private insurance, I think we cannot fund. One of the funny things that happened in the ruling is the decision included a statement that, oh well, the surgeon can still go to take his patients to a private clinic and treat them there, as long as he doesn't bill more than the going rate for the procedure he does or she does in a public clinic, a public hospital. Well, the surgeon's fee for, say, a cartilage operation on the knee is about between $250 and $300, I think.
Mm-hmm.
The operation costs about $5,000, so the surgeon is supposed to pay the rest of that money out of his fee of $250 or her fee of $250. It's a crazy statement to make, and shows a profound misunderstanding of the data, a misunderstanding of the medical side of it, and for sure, I mean, one of our plaintiffs was a young man who waited 27 months for his surgery on the spine at the age of 15 or so, and he has ended up in a wheelchair, paralyzed for life. 27 months was 4 times his time that he waited was 4 times the maximum medically acceptable time for surgery, and that has been condoned by the decision.
Wow. So now they're trying to argue that if you allow private clinics, that it's going to bleed the public system and it's going to destroy healthcare for everyone. Speak to that and whether there's any truth to that.
Well, there are 200 unemployed orthopedic surgeons in Canada right now. They can't get operating time in the public health system. It's rationed at the system. So this is an economic decision of the government to not fund healthcare. And then they're saying, well, we can't fund it, but we're not going to let individuals fund it either. To me, the workers' compensation example stands out as the Workers' Compensation Board covers you as a private insurance scheme, completely funded by employers. It has no government funding. It's a private scheme, and it is allowed to treat people. So one of our witnesses in the case had injured his knee at work and got treated quickly. Other knee, same injury, playing a sport, and was supposed to wait 2 years. Off work for 2 years. Suppose he would have been off work for 2 years for an operation that his monthly salary would pay for, and yet he had to wait and miss wages for 2 years. It's actually, I think the fact that it's the only country on earth that does this, that it's not, that in countries like communist China, most of the hospitals are private hospitals. They don't have a problem with it. Why? The Swedes, the Danes, the Norwegians, the Belgians, the Dutch, none of these countries outlaw private insurance. These are the British. These are not right-wing radical regimes. We are unique in the world in having a law like this.
Do you think that these people want us sick?
I'm sorry?
Do you think that these people actually want us sick, or is there some agenda of control? What is?
Oh, it's a control by public sector advocates and by ideologues. And the trouble with ideologues is that the rules are for the others, not for myself. So when the tanks broke through the barriers in the former Soviet Union, they found private hospitals for the Central Communist Party committee members. That's what happens. As I said, the instigator of this lawsuit that we had to respond with the constitutional challenge was the BC Nurses Union. They send us patients. There is an advocacy group called Canadian Doctors for Medicare who are mostly non-practicing, or they don't do the kind of nitty-gritty, hands-on frontline work that most of us do. They intervened against us. Some of the leaders have used multiple visits to private clinics themselves. That's what we're facing. That's what we're facing. It is a bizarre situation, but it's when it's hypocritical, except that they don't see it, because until you're the person involved, until it's your family, your loved ones, you think it's okay. The health system works wonderfully in British Columbia if you don't need it. It also works quite well for dire emergencies in most cases, but not in every case. Not in every case. Like, a lot of people are dying because they're not treated in emergency quickly enough. But as I said, the fact that since we started our lawsuit, 75,000 Canadians have died on the wait list is just unacceptable. And that has been condoned and endorsed as acceptable by this court.
Wow. So what? Where does it go from here then? You're going to appeal?
Go to the Appeal Court of British Columbia.
And then I do want to...
eventually it's likely to the Supreme Court of Canada.
Now, I want to know what the restrictions exactly are going to be, the new restrictions that come to you as a result of this verdict, and if they come right away or not.
No, we will seek a stay of execution, if you like, of the ruling. So that we will seek an urgent stay of application of this ruling.
Okay, so would it mean then if it did, if the stay expired or this really came into effect, would it mean then that you could not? You could not operate at all as a private clinic, even in the way that you are now?
We could only operate on non-residents. I mean, as I said yesterday, I operated on an Albertan that's completely legal. But if you're a BC resident, so you basically have a sign up outside your door saying you can only come here if you're not a BC resident.
But that's all you've been able to do thus far anyway, correct?
No, because we've admitted all along, and the government has known all along, that we have been in violation of the law in British Columbia for 25 years, because we considered it an unlawful law. So just as abortion laws were considered, abortions were being done and they were unlawful, safe injections were being done and they were unlawful, and so on and so on. Just because there is a law on the books, that's what the Constitution is all about. In Charlie, in Quebec, the Supreme Court of Canada ruled that Quebecers' rights were being violated under the Charter of Rights, where we're saying shouldn't BC residents have the same protection under the Charter of Rights that the Supreme Court of Canada gave to Quebec residents. And this judge said no.
Wow. So now tell me the patients or the spectrum of patients that you can treat now that you've asked them to clarify this and they've decided, well, no, we're gonna decide that this is illegal. What percentage of your patients and what kind of patients?
We'd have to break that down, but I would say a lot of our patients are outside of like workers' compensation or so-called exempt federal employees who don't live here.
Right.
Residents from the rest of Canada are all allowed to come here. Foreigners are allowed to come here. To give you an example, I've looked after a lot of international athletes personally. During the Olympics, I looked after and treated Olympians, gold medal winner from Australia, medalists from Russia, and also Olympians from Canada, from British Columbia. When we were treating the foreigners, we were completely within all the laws of British Columbia, but the Canadian was supposed to go on an 18-month wait list. That's how bizarre this is. I hope we can get a quick hearing before the appeal court. We're going to try, because I think the deaths that are happening is perhaps the worst. deaths and suffering. People are suffering. You know, we're in the middle of a fentanyl crisis with drug overdoses and so on. What has to be appreciated? A lot of those, I don't know how many, but I know a lot of people who become addicted to drugs do so because they're in pain, waiting for medical treatment that they're not getting, and in fact are being denied by the government.
Wow. Any other closing comments you'd like to make?
No, I think I said it all.
Thank you for speaking to me about this.
Thanks, Liam. We'll maybe talk again as it works its way through this quagmire of health, of law, of the legal system.
Indeed. Well, it's a beautiful day.
Take care.
Bye-bye. Were you surprised at the verdict?
I think the defenders of the status quo have done a very good job in Canada of convincing Canadians of a false dichotomy and a choice that doesn't actually exist. The Canadians remain convinced that there is only a choice between the universal system we have now and some imaginary construct of the American system, which is non-universal. And that's just not true. The reality is that we can have choice and have a universal access healthcare system, just like the Swedes do, just like the Australians do, just like the Britons do. And in fact, if we look to countries like Sweden and Australia, we can have a better universal access healthcare system at the same time.
What do you think were the biggest omissions then for what the judge was saying and not recognizing in this?
I think there was a recognition that Canadians do suffer, and then the question became one of, is it enough suffering and what happens to the universal system? And that's where the disconnect is. There is not a choice between having choice and universality. That's not the choice. The choice is in between having choice and allowing people the opportunity to look after themselves with their own resources when the universal system is unwilling or unable to meet their needs, and not. It doesn't have anything to do with universality. Universality is maintained separately from the choice to look after yourself.
Do Canadians have a healthcare system that they can be proud of?
The Canadian healthcare system is one that many Canadians are proud of, but let's look at the facts. The facts are that it is a relatively expensive healthcare system internationally, and yet it has mediocre access to resources, mediocre outcomes, and some of the longest waiting lists for access in the developed world. And let's remember, we're the only system that disallows a private alternative. So we spend more than everybody else, we get less in return, and we're the only ones who say you have to deny choice to allow this.
The other side says things like, if we have more of a private system, it's going to deplete the public system. Is that a kind of a short-sighted look at this?
It's oversimplified and it's incorrect. The reality is that a more blended healthcare system with more private options and a better universal construct would take us towards a system like Australia, where they actually encourage uptake of private insurance. They encourage people to use the private system because it's recognized that actually reduces the burden on the public purse, and it improves performance when patients aren't shackled to a monopoly.
Wow, so is the other side then, are they just basically stuck to an idea that doesn't really bear out in any kind of practice?
The defenders of the status quo have been standing on that position for a long time, and they've spoken it well, but the reality is it's incorrect. The idea that we cannot have choice if we want to have universality is just wrong.